Okay, so to position for a right lateral thoracic radiograph, we have the dog lying in right lateral recumbency. This dog is sedated, so we have sandbags across the neck and holding the hind limbs just to strain him. In terms of positioning, the first thing we need to do is to get the forelimbs extended cranially. So we do this with a couple of sandbags, up and round, draw the forelimbs cranially, so as we don't have any of the forelimb muscles lying over the cranial part of the thorax. The other thing we need to consider for positioning is to avoid any axial rotation, so we take a triangular foam wedge and place this under the sternum, so that the sternum and the dorsal spinous process at the back here are the same height off the table. To center and collimate, turn on the light beam diaphragm, palpate the caudal border of the scapula, and we center the beam about 2 finger widths caudal to that, about halfway up the thorax. We then collimate to include the ventral skin surface, and we can be just inside the ventral skin surface dorsally, and we open up to include as much of the last ribs as we can, as many of the last ribs as we can, and up to the thoracic inlet. We would then measure the depth of the thorax using a set of calipers to determine the exposure factors we need to use. Finally, we place a right lateral marker in the collimated area but outside the area of interest, so you know which side's which.